I'm Trevor Riley. Here is a look at the COVID-19 situation at the latest update of April 15th. We had no new confirmed cases, which keeps us at 14, and no new deaths, which is at 1. Total tests done sit at 842, and an increase in negative tests coming in at 653. We are currently awaiting the results of 175 tests. In Ontario, the number of cases went up by 494, bringing the total up to 8,447. That is a 6% increase from the last report. 385 deaths have been reported, and total testing in the province has now reached 119,000 at the 10:30 a.m. update of April 15th. Today we are checking in with the Dean of Algonquin College's Pembroke campus, Kelty Jones, to talk about how the school has adapted to the COVID-19 situation. And following that, we are going to catch up with Fire Chief Dan Herback of the Pembroke Fire Department.
Everybody really has turned on a dime and moved into this kind of remote delivery. It's not online learning. Online learning is a very specialized way of designing courses. It's a very different type of thing. But we've really, flipped to be able to deliver a lot of our content in a remote manner in a way that is quite remarkable. I've been amazingly overwhelmed by the amount of energy that people put into it, the flexibility people have shown, the new skills people are learning to try to get themselves through this. And that's not just the students learning; it's also the faculty learning as well and the staff. And I actually held a Zoom drop-in session, meet the dean session with the students earlier this week, because I just wanted to check in with them and see how they were doing and hear from them. And I'll be honest, I miss seeing the students, so it was nice to connect. And they were all very positive about what's happening. There are students who are struggling, no question. We have students who are trying to write their tests with a toddler in their lap, and they don't have extra help, and their daycare is closed, and there's a lot of uncertainties and a lot of stress. And to address that, the college has put in place a policy that allows students to, if they feel like their final grade really doesn't reflect the level of effort or their abilities in the course, they can request what's called an aggregate grade, which is an AG, which basically says you have competently completed this course. We are absolutely planning to be taking students in the fall. We have students in the application stream. We've already got students who've committed. Today we were discussing how we are going to deliver a much more robust online open house. So our open house happened to happen in March. It was scheduled for March 15th, which was 14th or 15th, whenever the Saturday was. It was one of the first casualties of all of this. It was one of the first events that we canceled as a college. And, we had some additional information available online, but we want to make it a real session. So we're going to have some real interactive sessions, some opportunities to talk to program managers, to talk to the staff, to talk to me, to get a chance to get a sense of who they would be coming to in the fall. Well, convocation is put off, so it will be put off until October. I believe the date that we have tentatively scheduled is October 24th. No guarantees that that's it. That's what we're holding on our calendars right now. We are going to shift modes a little bit, though, because we expect the ice will be in the PMC. That's our typical venue, so we're looking at ways to deliver it on our campus. The upside with that is we had some programs that were supposed to finish up at the end of this term that still have some content that they need to cover, and so they won't have that covered because it's face-to-face things. They wouldn't have had that covered before our graduation date. So this way, by extending that ceremony into October, we're going to have the chance to have all of those students graduate and celebrate together as well. So that's our plan right now. We're working on lots of different options as with that as well, making sure we've got a plan B and a plan C, as we pretty much do with everything nowadays. The flexibility that we've gone through, the changes that we've gone through, I think, they've created some wonderful learning opportunities for us, but they've also created some great opportunities for connection that we wouldn't have had otherwise in terms of partners that we have. We had our office administration students beta testing the call-in COVID-19 assessment system that they created. So the paramedic service created the system and they used our students to test it. So, we're still doing those volunteer things in the community, even if we're doing it remotely. We're still staying connected. We believe in our community, and we believe that it's important for us to be part of starting everything up again and recreating the economy that has been put on hold. So I think the message that I have is just keep staying safe, and stay safe physically, stay safe mentally. If you're on your own and you're isolating alone, make sure you find ways to connect in with people. Make sure you find ways to talk to people and make those connections and do things together. My family, I've had a daughter in Oregon, I've got a daughter in another city, and other family here in the town. And so we did a joint video call, and we all watched Outward together in our separate spaces, but we had that chance to connect. And those are the kinds of things that you can do.
Welcome back. The Pembroke Fire Department has been busy gathering donations for the Pembroke Regional Hospital, and we talked to Chief Dan Herbach about the changes in the firehouse and how COVID-19 has changed some of the daily routines.
The changes that we've had and the changes within the station are mostly to ensure that we're safe when we're here at work. And that the people that we generally provide the service to are going to be safe, and that we can do everything we can to make sure it's that way. Our call volume has actually gone down, and that's to be expected. We always see a lot of accidents in the city and outside the city, as well as we help with medical calls, and we help with lift assists and locked door rescues for when people have fallen and can't get up. Well, there's people are at home now, and they have help, and they're not leaving their houses in a hurry and forgetting to turn off their burners. So our call volume has gone down, and of course, car accidents. There's so much less traffic that we're seeing a lot less. Well, that was something really cool, and it had been brought to my attention a couple of weeks earlier. And we saw it as, let's keep this as something that maybe we'll do if this continues for any amount of time. And that's sure enough what happened. Chief Sutcliffe from Laurentian Valley brought it to my attention that he had been thinking about it, but wanted to make sure that he was doing it in conjunction with the Pembroke Fire Department, because the seniors' homes and the hospital are in the city. I said, I think it's good timing, and it came together pretty quickly. I think that the people in the buildings and working in the buildings deserved it immensely, and deserved to have us let them know how important it is what they're doing, because as much as we are as firefighters and police officers, the paramedics and the healthcare workers right now are the ones that are on the front line every minute of every day, and they deserve to know that we're thinking about them, and that we're thinking about what a great job they're doing in that daily basis. The way that started was we had seen that there was a need, and we were contacted. I believe to tell you the truth, I was working from home at the time. I was on a 14-day self-isolation. And what happened was we were contacted about being a drop-off point to help alleviate drop-offs at the hospital. With them asking for that help and for that need, they said, could the fire hall be that? Well, we needed to meet some certain criteria to do it, and that was making sure that people weren't dropping off here and we weren't having the contact here instead of somewhere else. So essentially what we did is we set up a drop-off area at the front of the building where it's covered, and we make a call to the hospital, and they have a volunteer come by and pick it up whenever there's an amount here that they need, and that's working out really well. The Ontario fire ban was put out to ensure that the province, as well as other emergency services that respond to these wildfires and any other fires, have the capabilities to do it. And at this time during COVID, with the amount of people not working and things not being ramped up, they just don't have the capabilities. So the fire ban was put in place for that reason, and it's a really good reason. We have to make sure that there isn't going to be any wildfires, and they always start from a small fire. Some of the things that we are trying to get out to the public about the service that we're providing and the changes that we have done since the outbreak of the pandemic. And some of them are suspending all of our non-essential fire prevention and public education activities. So unless we have to go out for an inspection or have to go out for something in public education, that has been suspended. So again, that's a lot less seeing the fire truck driving around town, parked at the schools or at seniors' homes or anywhere else. Another one that we did was we changed we approved changes to the vulnerable occupancies. Their fire drills, that being seniors' homes, care homes and hospitals, that when they do a fire drill, we're hoping that they go ahead and still do their drills, but they do not gather as they normally would. We have a dedicated delivery entrance here at the fire hall, so any deliveries will go there, ensuring that we also have no contact with the delivery or the delivery persons. The building is closed to the public. We've revised some of our responses. A response to a carbon monoxide call generally would have our truck respond in a non-emergency mode with our crew, unless, of course, we had evidence that there was signs of real carbon monoxide, not just a detector going off. So now we're responding to these with the minimum amount of staff and maybe with a smaller response to make sure that we don't have very much contact. We're doing the same at the seniors' homes. Our response to a senior home or the hospital would normally be with the full crew entering into the building to go and investigate what the call or what the alarm is from, where the fire or the possible fire could be. Now on our response, we are responding to the door with one officer, and the officer will ascertain from outside the building whether or not there's a need for us to enter into the building, using the staff inside the building as our important key touching point. And so those are some of the things that we're doing that have changed what we've been doing since the start of the pandemic.